Every year, several 100,000 Europeans lose an arm, foot or leg due to accidents or circulatory disorders caused by diabetes or smoking. The loss of an arm or leg is often a sudden and massive shock in the life of the person affected and their loved ones. And it's a crisis for which nobody is prepared. The desire to get back to an active and autonomous life is strong. People want to live their lives as smoothly as possible, spend time with their partners, families and friends, go on holidays, travel, practice sports and work. But doing these everyday activities can be challenging. For example, people who use a prosthetic hand have to relearn activities, such as blow drying their hair. And close contacts also have to cope with the change. Frequently, the loss of a limb causes psychological problems, such as depression.
In such a situation, it takes more than anonymous information and written advice. What really helps is not being alone and having a personal exchange with people who have faced and overcome the same challenges. There are self-help groups on the internet and on social networks, but the information there is very diverse and can be confusing. Additionally, limb loss is a very sensitive topic, and group members can find that they are discriminated against or even sexually harassed. Protection of sensitive and personal data is therefore key. These are very personal topics. What's needed is a community platform that enables direct exchange between parties, but that guarantees trust, security and privacy.
As part of the Living Innovation project, Otto Bock, the world market leader in the development and manufacture of prostheses, addressed this problem. The starting point was to understand how amputees can be supported in their everyday lives, far beyond the design and creation of the prosthesis itself. From a responsible innovation perspective, this is particularly interesting, as the focus is not on the design of a new technology or a new product, but on the consistent focus on user needs.
In the first step, 3 workshops were organized in the Netherlands in 2020, where Otto Bock employees talk in detail with prosthetic users about their lives. With empathy and understanding, 3 insights were drawn. First, amputation is overwhelming, especially when it happens suddenly because of an accident, but also when it has already become apparent due to diabetes. Information available on the internet is usually too confusing. What is needed is good starting information, tips on living with an amputation, and a single contact point where all relevant information is available in a compact form. Second, often the quality of the information is unclear. As goes for everywhere on the internet, it's all too easy to find false, incomplete, highly simplified or biased information. Verified and trustworthy information is what is required. Third, but information alone is often not enough. In many cases, people can feel somewhat abandoned, and perhaps their family is also overwhelmed by the new situation. Therefore, contact with people that have already experienced and mastered the situation is essential. Unfortunately, this openness can be abused, as fake identities can easily be created on the internet.
Based on the findings of these workshops and Otto Bock's extensive experience with its users, they developed Movao, a community platform for people with arm and foot prostheses. It was designed as a modular system that can be easily expanded. The pilot was tested by approximately 20 prosthesis users and improved based on their feedback. In the next step, the platform was translated into several languages and rolled out globally, giving people from all over the world a central hub with compact information on everyday life with prosthesis and a place to exchange information with other affected people. Movao's key features are: users and their loved ones can request to join the community and will be approved by a community manager, who also monitors the platform to prevent abuse. A live feed, similar to other social media platforms, facilitates exchange of experiences, problems, and possible solutions in daily life with a prosthesis. There's a section with compact, relevant information. It's important that this information is quality assured and manufacturer neutral. There are personal stories written about the life with an amputation. A member area enables users to search for others with similar life situations or interests. There's an interactive map which allows users to look for others in their region or city. In this way, the platform contributes to direct networking. And the platform is complemented by a discussion forum and an event overview.
Movao will continue to develop additional features, as well as online and offline programs, creating a space where people can come together and support each other. Heinrich Popov, multiple Paralympics medal winner, makes his personal experiences available on Movao and has worked closely on motivating people who have lost a limb. The platform will continue to be developed in the future based on regular feedback and suggestions from the community.
Ottobock's Movao platform is interesting for people beyond the company and the community of people who wear prostheses, especially from the point of view of responsible innovation. It shows perfectly how the focus can be expanded from the product to the underlying need, the entire everyday lives of those affected and their difficult situations.
In the healthcare sector, patient empowerment is increasingly important, giving targeted support to patients so they can make more informed and better decisions about their lives. Movao aligns with this increasing trend, and it's also a good example of the participatory aspect of responsible innovation, which is about innovating with the people and for the people.